Guys, how are you doing? I hope you are doing well and welcome to today's session of learning. Today I want us to tackle very important topic, and I want us to learn on about HIV in pregnancy. HIV in pregnancy. So from the topic you can see this topic is very important. Okay, so guys, if you're new here, feel most welcome. If you're a member, welcome also. If you have not subscribed, please consider subscribing and let's grow this channel. And if you have any questions, ask me down there in the comment section. I will try in my level best to answer your questions. So today, as I have already told you, we want to learn about HIV in pregnancy. Okay, so during pregnancy, HIV can pass from mother to child. Okay, through the placenta. This means this baby can be infected when he or she is in the womb, in the uterus. It can be transmitted from mother to child during childbirth. Okay, so during childbirth or during breastfeeding. Okay, so there are three major ways in which a mother can transmit HIV from to her baby, to the fetus or to the born baby. It can be transmitted when the baby has not been born in the uterus, okay, through the placenta. Number 2, we have during childbirth, or number 3, we have during breastfeeding. Okay, so it is very important whenever a woman notices that she is pregnant to start antenatal clinics immediately. Okay, so this is when an HIV test can be done. Okay, there are those women who get pregnant while they have HIV and they are on medications, and there are those women who can get pregnant and they are not on HIV medication simply because they had not discovered that they have HIV. Okay, so it is important whenever you get pregnant, if you are on medications, on HIV medications, still you need to start early so that your doctor can advise you on how you will be taking your medications. And also, if you don't know your status, it is good to do a HIV test immediately you notice you're pregnant, so that in case you are HIV positive and you're not on medications, you can be started on medications, or you will be advised accordingly on what to do to avoid transmitting the HIV virus to your baby. Okay, so I want us to learn on what you can do to reduce the risk of passing HIV to your baby. Okay, during pregnancy, during breastfeeding, or during childbirth. Okay, so number 1, if you are HIV positive and you are on medications, go report to your doctor. He will advise you, and what you should do is take your medications as prescribed. Okay, take your medications as prescribed or as advised by your doctor. That is number 1 way you can avoid transmitting the virus from yourself to your baby. How is that possible? When you take your medications as prescribed, the viral load in your body will go low very, very low. That is if you take as prescribed. And then, when it is low, then you cannot, it is not able to be transmitted. We say undetected viral load, okay? So when it's undetected, it cannot be transmitted from you to the baby, okay? Number 2, give HIV drugs to your baby after birth for 4 to 6 weeks, or as advised by your doctor. So you have been HIV, you are HIV positive, you are pregnant, make sure you take your medications. Immediately you give birth, there are those medications you will be given by your doctor. Make sure you give your baby those medications for 4 to 6 weeks, or as you will be advised by your doctor. That is a number 2 way you will ensure you will not transmit, or your baby will not get the HIV virus. Number 3, make sure you attend antenatal appointments as advised, okay? That is the same point as I told you. Make sure you visit the antenatal clinics immediately you notice you're pregnant, so that you can do a HIV test, to know your status, okay? If you are positive, then you will be started on medications to avoid transmitting the virus to your baby. Another point is if you are at risk, okay, of getting HIV. Let's say maybe you are pregnant, and then during your pregnancy you engage in sexual affairs with somebody or a person whom you don't know their status. If that ever happens, make sure you visit the hospital so that the doctor can advise you or will give you some meds to prevent getting the virus, okay? The pre-exposure medications, okay? The post-exposure medications. You are HIV negative and you're pregnant, and then you engage in sexual affairs with someone you are not sure of their status. Please report to the doctor so that they can advise you. Maybe you can be given a post-exposure prophylaxis so that you don't get HIV, okay? Number 3, get to test your viral load, okay? So that you can know if your viral load is detectable or not detectable. The viral load is the one that decides on how the mode or how you will give birth. The viral load will decide if you will go for a normal delivery or you will go for a CS, okay? Your doctor will advise you on that one. So if you are living with HIV and taking ARVs, okay, correctly as prescribed by your doctor, during pregnancy and breastfeeding, this one can lower the risk of transmitting HIV to your baby, okay? So I want us to learn about breastfeeding, okay? You are a HIV positive woman and you have given birth. What should you do, okay? Breast milk contains HIV, okay? Breast milk contains HIV. So the guidelines on whether or not to breastfeed depends on what resources are available at the moment, okay? So your doctor will advise you if you can access formula milk and clean boiled water, okay? You will discuss with your doctor. Your doctor will tell you if breastfeeding is advised depending on the viral load on your body, or your baby will take formula milk. Okay, so if you can access formula milk, clean boiled water, you will be advised accordingly, depending on the viral load. If your viral load is detectable, then your doctor will advise you to give your baby formula milk. Okay, or if you will opt to breastfeed, then your doctor will give you guidelines. You are supposed to breastfeed exclusively without giving any other meals, okay, for 6 months, and then now you can introduce another feeds. Okay, talk to your doctor to get specific advice. Okay, so your baby should be tested for HIV after 4 to 6 weeks. As I have told you, once you give birth, your baby will be started on medications for 4 to 6 weeks. Once the period has elapsed, your baby will be checked, will be tested for HIV. If the result is negative, she will be tested again at 18 months. Okay, and then if the result is negative, the baby will be tested again when they stop breastfeeding, okay, to confirm the status. Okay, but if your baby turns positive at 4 to 6 weeks, then they will be started on medications immediately. Okay, so yes, that is it. In this topic, I just wanted to pass this information on how to reduce the risk of transmitting HIV to your baby. Okay, and I think I have given you those points about breastfeeding your baby, or about the baby feeding. That one you will discuss with your doctor. You will be given specific advice. Okay, depending on the viral load on your body, your doctor will advise you whether you need to breastfeed your baby or your baby will need formula milk. Okay, so thank you so much for watching. See you in the next session of learning.